forward on this computer. Okay, so we are recording now. Again, for those who are watching the replay, I'm Andrea Crafton, a holistic mama coach and doula, also a therapist. So we're going to be talking about the common myths and truths of breastfeeding. So I'm going to go ahead and get started. Let's first go over the pain during breastfeeding. How many of you all have been told that pain during breastfeeding is completely normal? I have. I remember breastfeeding my first baby, and as soon as he would latch, I remember curling my toes on the coffee table and literally screaming because the pain was so excruciating. Even my mom, though, who breastfed all 5 of us, said, Andrea, that pain is normal. I'm here to tell you that if you are experiencing pain during breastfeeding, that pain is definitely not normal. So if you are experiencing pain, there obviously is an issue that's going on with baby latching. We're going to go through some of the possible causes of pain, but that is your first clue that something is not right and there is probably an issue going on. Now, some mild discomfort. Pain should only be mild with some discomfort or pain. It should not be excruciating like I just explained and described. Of course, because breastfeeding is new, some pain, if it is mild and that discomfort only lasts no more than 30 seconds, then you know that some of that is normal or can be expected. However, like I said, if that pain is excruciating, if it's lasting longer than that 30 seconds, there is a major issue and it needs to be corrected for sure. So how long should that discomfort last? It really should last no more than 2 weeks. And a lot of the breastfeeding experts, they say that pain really peaks around day 3 and 7, between day 3 and 7. We also know that is basically the days or in between the days that your milk will more than likely come in. So baby's going to be nursing a lot. Baby is learning to nurse. Mom is learning to nurse. And so, again, some of that discomfort is completely normal, but not excruciating. Another way to tell that, okay, something is just not right. If you are experiencing any cracked or bleeding nipples, that is another, sign that, okay, this, obviously, if you're experiencing pain, you're probably having some cracked and bleeding nipples, possibly some scabbing. I remember having lots of scabbing on mine. Even the blood blisters, you can develop those as well, and that's a sign that something is just not right. Also, if baby unlatches and you look down at your nipple and your breast and your nipple looks like a lipstick tube, if it is flattened or if it is crushed, that is another sign that something is not right. The anatomy of your nipple itself or your breast should not change because of baby nursing. Obviously, we know that our breasts change when we are pregnant and we are nursing. Those things are definitely expected and normal. However, that anatomy of the nipple itself changing after baby is latched is definitely not normal, and that is another sign that something is just not right. So go ahead and comment. I know there's quite a few of you all on. Comment and let me know if you yourself experience any of those things with your baby, or if you are pregnant, you now have this knowledge and these key issues to look for, because that is a sign again that something's wrong and that we need to get it fixed. So let's go ahead and move down to the causes of pain during breastfeeding. So there are a lot of common causes and different things that definitely can cause issues with breastfeeding. So one of those is obviously just baby having a latch issue. Different anatomy issues and different things can definitely cause a latch issue. So one of the most common is a shallow latch for baby. So baby's lips are tucked inward. So don't laugh at me, you all, but instead of baby's lips flanging out around the breast itself, their lips are actually going to be pointed inward. So sometimes, or the chin will be pointed down instead of it being raised, and their lips are out over the breast itself and the nipple. That tells us that there's a latch issue. So basically, what is happening is, the nipple itself is not getting to the back of the baby's palate like it should. So instead, that the nipple itself is being crushed onto the baby's gums or to the hard part of the palate itself. So more of an upward area up here where the area is hard. Because when a baby breastfeeds, the nipple itself really just goes to the back of the mouth, and they just actually just suck and swallow. That's it. So we know that that's probably a latch issue and an issue with the palate if they're having a shallow latch and those lips are pointed inward and down. Now, the other issue that comes around is the engorgement. So we know that when our milk comes in, you're going to experience a lot of leaking, you're going to experience engorgement, and your breast, because that milk has not regulated, your supply has not regulated, your breast more than likely will be engorged. So there are some ways to help with engorgement. However, we're just going to be talking about the causes today. But a lot of mamas do definitely experience engorgement issues. I will say, though, normalizing that engorgement again, you are going to have a lot of supply of milk more than likely when your milk comes in. And that is really just to make sure that you have a sufficient supply for baby, because they are nursing a lot during those first 4 to 6 weeks. We know that it's a constant, really growth spurt. And again, nature is really wanting us again to regulate our milk and to let our bodies know, hey, my baby is here and this is what my baby needs. So I don't want, like, if you are engorged, I don't want you to think, oh my gosh, I'm engorged and what do I do now? There are some ways to help with engorgement. However, some of that is normal. Now let's go to, I'm going to skip over tongue ties and lip ties just for a minute. The contact dermatitis. So a lot of moms don't realize that, the nursing raw material they may be using, the nursing pads, we know those disposable nursing pads can actually stick to the nipple themselves. And as you are taking them off, it can actually cause nipple pain as well. I so remember those days before I knew that even cloth pads were an option for me. So I would highly recommend, if you are prone to skin sensitivities, to look into nursing pads that are made out of the bamboo or cotton, hemp. Those are really good options. Plus, you're saving money with those. And let's be honest, any of the cloth options, they're definitely going to be healthier and just overall natural for you. But, that is one, reason why some moms definitely will have nipple or breast pain is, an allergic reaction to the pads themselves, or even the creams that we use. I can remember them giving me the Medela cream or the Lanolish or whatever it's called, nipple cream and we need to be aware of also the ingredients and the products that we're also using on our breast area as well. That's why myself, I have the Mama's Blooming handmade products, and that's really, again, one of the main reasons I started a product line is so that I can ensure that I'm using products that are safe with clean ingredients for my family. But again, and wiping off the breast constantly if you're using those balms. So all of those things can definitely cause contact and dermatitis issues for your breast and nipples. Now, some moms, they do have a forceful milk letdown. And some of those signs that you may see with baby are gagging, choking, pulling off and on off of the breast, just an oversupply, spitting up, clamping down onto the breast. So even though sometimes, you may experience those things with baby, if you're seeing that there's a pattern every time baby breastfeeds, then obviously, something could definitely be going on with your baby. So let me see here if I can share the slides that I wanted to share with you all today. I'm not sure why it's not working. Let me see here if I can exit the full screen. There we go. So let me see if I can get these slides up here to talk about the breastfeeding issues, and it is not working. You all have to love technology, right? Let me see here. I'm going to be sad if I can't get it on here. I got it to work yesterday. Let me see if I can get it on. For some reason, it's not working. Oh, here we go. Here we go, guys. So here are some of the signs for a tongue and lip tie. So I know with both of my children, they both were born with a tongue and lip tie. However, with my first, I had no idea what a tie even was, what to look for, the warning signs, nothing. And I will tell you that I still have moms who message me quite often or comment in the Mama's Blooming group who, you know, they tell me what's going on with baby, and I'm like, you know, it really sounds like baby could possibly have a tongue and a lip tie. You know, I know that more mamas and there's more skilled professionals and providers that know about tongue and lip ties, that you would be so surprised at how many pediatricians and lactation consultants even miss tongue and lip tie issues. I know that with my first, you know, I kept taking him to the pediatrician because he was having weight gain issues, and oh my gosh, again, my nipples were feeling like they're going to fall off. And really the only feedback and advice that I got was, you're just going to have to supplement. You were definitely having a supply issue. No, I was not having a supply issue. And so what happened was I said, there's got to be more. So I started researching. I finally sought help from a lactation consultant who confirmed that there were tie issues. So let's just go through some of these. We've already talked about the cracked, blistered, bleeding nipples. That's a big sign for mama. Plugged ducts. I definitely had a lot of clogged ducts, discomfort while nursing, sleep deprivation because baby is not able to nurse sufficiently. They may compensate by nursing more, often including at night, thrush, compromised milk supply. So, you know, with the tongue and lip ties, you can have a milk supply issue, meaning you can have a definite oversupply or an undersupply of milk. Baby, I know with both of mine, they were constantly needing to nurse. Babies, when they are born, I want to clear this up, definitely, they do want to nurse a lot. But however, if you feel like your baby is definitely nursing excessively and they are nursing for really long periods, like I can remember, especially with my first, like he would nurse, it would take him over an hour to nurse, literally. And I'm not talking like just dream feeding nursing. I'm talking about literally working so hard at the breast to nurse. And so what really happens is they may be getting the amount of milk that they need, but they're burning up all of their calories that they're taking in. So they're not transferring milk like they should. And if they are transferring milk like they should, they're burning a lot of those calories that they need to gain weight. So the plugged ducts is another issue because, again, baby is not transferring milk like they should. And again, with the oversupply or undersupply, again, it's because even though baby is nursing, they're not intaking what they need and what they should be getting. So it's telling our bodies to produce less and less, it could be. Another signs, let's go to the babies. So reflux or colic. Difficulty latching, gumming or chewing at the nipples, gassy, poor weight gain, makes clicking noises while nursing, excessive drooling, choking on milk and popping off. Now, we have just discussed that those signs can also be a sign of the forceful milk letdown also. So again, it's really looking at the signs and symptoms and really trying to figure out what's going on with baby. The clicking noise is definitely a sign, popping on and off. You will also see in a tongue and lip tie baby, which is not listed here, but you'll see that they have nursing blisters on their lips. So it's just like clear little like blisters. And again, this is because they're having a latch issue and working super hard at the breast. So those are just some of the more common issues that you're going to see with a baby who has a tongue and lip tie issue. Now let's go to, let me see if I can do this again. Let's go to, now how did I do that? Sorry, you all. So let's go to, let's see here. That's not going to help me. So, you know, also just looking at the anatomy of the baby. So there's two kinds of lip and tongue ties. There's a posterior and anterior tongue tie. A professional skilled provider, they are going to have to determine if there's a lip or a tongue tie issue. However, I will say that pediatricians are really not versed in ties. So if you go to the pediatrician and you say, you know, my baby is experiencing all of these different signs and I really want to know what's going on with my baby, and you're questioning if they have a lip and a tie issue, they say, oh, you know, baby can lift its tongue. That definitely does not mean anything. So I would strongly encourage you. There is a tongue tie group that I can definitely add you to if you let me know on Facebook that is super helpful. There's definitely different resources for you mamas because again, I was told both times with mine, even the second time around, baby definitely does not have a tongue tie or a lip tie. He did, which was corrected at 5 days old. So again, I would just encourage, like, go with your mama gut, and if, you know, a provider is saying this is not the issue, don't stop. You know, that's one of the reasons why I'm doing these workshops, because a lot of the information that we do get is just not correct information to help us succeed on our breastfeeding journeys. So that is that. Let's go down to, and again, you all that are watching, please use your chat option down at the bottom. Again, you can write out comments and questions as we go along, or write them on your outline. So let's go down to, I'm not producing enough milk, I have low supply, and I put sometimes that is a myth. Because definitely there are some mamas who definitely have supply issues. However, what I have found is a lot of times mamas think that they have supply issues because of the information they are getting. Information they're getting from friends and family, what they're getting from their pediatricians, from their hospital breastfeeding classes, from a lactation consultant sometimes in the hospital. I know the first time around I was given a nipple shield to take home. And again, that was because my baby was having trouble latching, but that's not a solution. Like, I was just given that nipple shield and I was like, here you go. But that definitely did not help the latch issue, and it definitely did not help my son's ties. So I'm saying that because the information that sometimes we get, even from the professionals that we want to trust, to give us the correct information, they always don't, unfortunately. So it's important to have that support person that you know that's giving you the evidence-based information that you need. So the first, a pump is not an indicator of what you are actually producing. And this is so true. I know that, you know, again, I talk to mamas all the time and they're like, you know, I'm pumping, but I'm only getting like 2 ounces every time I pump. And I just want to be a cheerleader for that mama because, yay, you know, that is wonderful. You know, they don't realize that, you know, what they're pumping is not an indicator of what they're producing, and it's not an indicator of what baby is intaking when they're nursing at the breast. So keep that in mind, that, you know, a pump is not a way to let you know that you're having supply issues. So again, don't look at that as, oh my God, I'm only pumping this much. Or even if you're not responding to a pump. Again, that is not, you know, telling you that you have a supply issue. So keep that in mind, that a pump is not an indicator of what you're producing, and is definitely not a sign that you have a supply issue. So your milk comes in between days 2 and 5. This is another, thing that I see quite often from mamas is, oh, I just had my baby 2 days ago and my milk's not coming in and I'm not able to give my baby what he or she needs. And so my pediatrician is really pushing me to supplement. Um, give your body time. Your body will produce that milk and your milk supply will come in. Just give it time. I've even seen a couple of mamas where their milk doesn't come in before day 6 or 7. So that colostrum is really what baby needs, for those first couple of days and sometimes even a week, the week of life. And so let's talk about, newborns lose 7% of their body fat and will gain about 6 ounces per week, which is about a half an ounce to an ounce a day. So let's talk about that weight loss. That really seems like a number that a lot of people are focused on. So, we need to normalize that weight loss is definitely expected. However, let's talk about those IV fluids that you get during your birth and labor. Now, not all mamas receive IV fluids, but there's a great percentage. It's like between 70 to 80% of mamas do receive the IV fluid during their laboring and birth process. So let's think about what's happening to that baby. They're gaining that water weight as well. And so I like to tell, breastfeeding mamas, let's look at that. Let's talk about, did you have those IV fluids and really, how much weight you can expect, or the baby to expect to lose over that time period, and how much of that is normal. Because IV fluids definitely play a huge role in that. So newborns, they lose, again, that 7%. And a lot of mamas also question, like, well, how much does my baby really need the first week of life? It's always astonishing to me the mamas who choose not to breastfeed, which is fine, or the hospitals, who say, you're just not producing, you're not giving baby what he or she needs, and they're having latch issues, and they bring out the formula that's already mixed, and they put that nipple on, and here you go. And then, I feel like it's kind of a downward spiral a lot of times, because then baby has a tummy ache because they're giving them way too much formula, way more than what their little body needs in their stomachs. And so a lot of times those colic issues, there's always an underlying issue. And so sometimes I do believe that sometimes those issues definitely start in the hospital when all that formula is giving. Baby doesn't need all of that. So let's talk about, how do we know that our baby is getting enough? So let's talk about the wet and dirty diapers that we can experience from our babies. On day 1, they really need, we're just looking for that one wet diaper and that one diaper with stool in it. Day 2, 2 diapers, wet and 2 stools. Day 4, you want 3 or 4 wet diapers and 3 to 4 stool diapers and 5 to 6 wet diapers. Now, I will say, both of my boys, they had plenty of wet diapers. They were definitely, pooping every time. Breastfed babies poop a lot, you all, especially in those first couple of weeks. And so I will say that, just because your baby is having plenty of wet and dirty diapers or stool diapers does not necessarily mean that there's not an issue. Because what was happening again with mine, they were, I didn't have a supply issue, but they were taking long periods to get what their body needed. And so what was happening, they were burning all those calories again. So keep that in mind, though, that low supply oftentimes, baby's not getting what they need. But those wet and dirty diapers in those first couple of days and even that first week, that's important just to keep a check on and just make sure that everything, baby is urinating and, having those stools that they need. So how much does my baby need in the first month of life? So again, this goes back to the whole concept and the worry of mamas, what happens if, I'm really worried that I'm not producing enough? That is like the number one concern that I see from moms all the time. And so let's talk about that. So the first day of life, really baby only needs a half of a tablespoon of colostrum. That's it. A half of a tablespoon. So think of just, your measuring spoons that you use at home and how small that really is. Also, just the 3 days of life, all I need is 3/4 of an ounce to an ounce. 1 week, 1.5 ounces to 2 ounces, and by 1 month, 2.5 ounces to 5 ounces. Also, with breastfed babies, I want you all to keep in mind too that really their intake, as far as ounces, I believe it's after that first month or so. That doesn't really necessarily increase. The fat content within your milk increases. So unlike a formula-fed baby where that intake really continues to increase during the first year of life, you're not going to find that with a breastfed baby. But your milk fat and the milk fat content in your milk will definitely change to baby's needs. Our bodies are definitely amazing and just producing what baby needs. So I want you to keep that in mind as well. That, again, when you are pumping and you're pumping for the needs of your baby, don't automatically think that you have a supply issue. I tell mamas that you just need to concentrate on pumping what baby needs for the next day. I know that a lot of moms worry like, oh, I should have this whole freezer full of milk, and I don't have a freezer stash whatsoever, and this is stressing me out, and what do I do? So I try to alleviate some of that anxiety, and let's talk about that and talk about just the needs of your baby for the next day or the next 2 days or whatever it might be. Let's have those short-term goals instead of my goal is to have a whole freezer stash of milk. So let's talk about that it's a myth babies need to be on a feeding schedule. So how many times have we heard that? You really need to get that baby on a schedule. That is just not true. Of course, we want our babies to nurse, and those first couple of days of life, they are definitely tired because they have been through a whole workout of, the whole birth process. So it's not unusual for them to want to sleep. But, again, that can cause some anxiety with mamas. If we feel like, oh, well, baby ate at 8 o'clock, and oh my gosh, it's already 10 o'clock, and baby has to wake up and eat because I need my baby to be on this schedule. I need baby to be on this schedule so that, with my other 2 kids or whatever it might be, I have to feed them at lunch at 12, and then they lay down and take a nap at 1. And I'm just giving that as an example because especially, within that first month, let's not talk about necessarily a schedule. We are just going to feed on demand, and we are just going to meet the baby's needs where they're at. And, just from the research and just from my own experience, you're going to be amazed that baby is actually really proficient at getting themselves on a feeding schedule because they're going to be more apt, their bodies are, to know when they need to eat and definitely be on more of a feeding schedule versus just a demand cluster feeding growth spurt schedule, which is what you're going to find your baby will definitely be on. So how often do your babies need to eat and nurse? So babies need to nurse between 10 and 12 times a day. So keep that in mind. If you're keeping a log or, just feeding on demand, just make sure that you are, getting those nursing sessions in because, again, the supply and demand is really what builds and keeps our supply up. And it really helps our bodies to regulate the needs of our babies. So how often should my baby wake to eat? Babies should wake at night at least every 4 hours. During the day, probably, around 2 hours. Now, we've all heard, should I wake a sleeping baby? That really depends on the age of the baby. And again, if you are on, if they're older and you are on a feeding schedule or they're kind of on their own schedule, If there's weight gain issues, if you're having supply issues, those are all the things that you really need to factor in if you should be waking baby. But, some of the ways that you can wake baby, if it's been 3 hours and you're like, you know what, this baby's really been sleeping and I really want to keep my supply up and regulate my supply, there's different ways that you can definitely get baby to wake up a little bit more, changing their diaper and undressing them, doing a lot of skin to skin, rubbing the bottoms of their feet, sometimes even taking a washcloth and just gently rubbing it across their back where their feet can wake them up. So those are just, some ideas off the top of my head that, you can use to wake your baby. However, though, we are not necessarily going to wake baby exactly at that 2 hours or exactly at that 4 hours to eat. So I would say, just try to use your judgment with those things. So let's see here. So your baby is wanting to nurse all the time. Definitely your baby's wanting to nurse all the time because they are cluster feeding. They are going through these gigantic leaps and bounds and, definitely on those growth and development spurts during especially that first month of life. So I hear it from moms all the time, like, I know I have a supply issue because my baby is wanting to eat all the time. Yep, you're a nursing mama. Let's also keep in mind that babies like to dream feed. So, just because they're at the breast suckling does not mean that is an entire nursing session. They are suckling at the breast also for just attachment and getting their other needs met. And again, that suckling and that dream feed again really helps to regulate our supply and to let our bodies know, hey, this is what I need to be producing. So keep that in mind that just because baby is at the breast does not mean necessarily that they are truly nursing. That is what we call a dream feed for sure. The first 6 weeks, again, the 4 to 6 weeks, there's a constant growth spurt. You may experience some engorgement like we talked about earlier. So regulating supply, which I also mentioned, I'm just looking at my notes here. So again, we just talked about this. So the key is making, sure that they are gaining weight. There's not any type of latch issue, and the output is consistent with what baby needs. And again, just trying to factor in and trying, okay, is this a tongue tie issue? Is this caused from engorgement? Is this, maybe a combination of things? Sometimes there definitely are issues that are going on. But what I have found is that sometimes there aren't any issues. And sometimes our own anxiety and worry and just not normalizing what's expected of breastfeeding can really get our minds going and really questioning if we are, being successful at breastfeeding. So those are just some things to definitely keep in mind. Let's talk about birth. So I want to preface this with, this is not to shame anyone if you did not have a natural birth experience, or if you had an epidural, you had a cesarean. That is not what I'm trying to do. I will say that my first birth experience, it was absolutely terrifying to me. I was induced, and there was just a constant, medical interventions that were just not needed. And so I can say that because of that experience, I do think that it was a huge factor in some of my struggles with breastfeeding. And the second time around was, with my whole, it was a complete natural birth, was just completely different. And so I'm just going to go over, some of the issues that I see and I hear from mamas who are experiencing breastfeeding issues. And just to keep some of these in mind, if you are wanting to succeed at breastfeeding and you have a birth plan, these are all choices that we can make as mamas during our birth. But not only that, but if you did experience some of these things that I'm going to talk about, again, it normalizes some of the issues and some of the experiences that you may be going through right now as a mama trying to breastfeed. So, normalizing some of those things can kind of have that aha moment of, I'm not feeling as a mother breastfeeding, or I didn't feel it at my birth. These are some of the reasons, these things that happened are some of the reasons why I might be struggling or going through with some of the things that I'm going through now, or my birth was a struggle. So I want to preface that. I don't want anybody to, think that I'm necessarily downing your birth experience. But I do think this is important to talk about. So let's talk about, let's see here, the induction and Pitocin, induction with Pitocin. So this is one that I hear and I see from mamas quite often. A lot of times their induction day is already set, and if they are past their due dates, a lot of times these medical doctors, they are pushing for that Pitocin to go ahead and use with baby to induce your labor. So really what happens when we use Pitocin, first of all, it's a synthetic hormone that is supposed to mirror the oxytocin, which we produce naturally as mamas, which is the love hormone, during our labor and birth process, but also while we are breastfeeding. So really what happens with that oxytocin is it, blocks the beta endorphins, which also help produce the prolactin, which is the mothering hormone, which tells our bodies to really produce that milk. So when we use that Pitocin, it's really interfering with our normal hormonal responses that we normally would, because what happens is that Pitocin is not crossing necessarily our brain barrier. So we're not experiencing that love hormone during our labor and birth experience like we would without the Pitocin. And so, with a lot of research and different things, it has been correlated with postpartum depression. And we all know with postpartum depression, that can lead to a lot of struggle with breastfeeding as well. So I'm just letting you know, there's other, of course, factors that play into Pitocin, but the hormonal responses that are normal during the birthing process with mom and baby, that just does not happen when we use those synthetic hormonal in interventions with our birthing process. Continuous fetal monitoring actually increases the risk of more interventions being introduced. So what we have found is the more monitoring, cervical checks, inductions, what happens is that we are on the time clock of the hospital or wherever we're birthing. And so then it becomes frantic. Like, we have to get this baby out by a certain time. If mom's not progressing the way that she should, then, we're just going to keep adding in all these medical interventions. And so, there's evidence-based research that states there's really no need for that continual fetal monitoring. And in fact, the continual fetal monitoring doesn't have any better outcomes than the births that have intermittent fetal monitoring. So I'm not saying there shouldn't be any monitoring, but having a mama hooked up to continuous monitoring can cause, definitely some anxiety, especially if she's not progressing, and also just more interventions introduced into her birth. So I kind of touched on IV fluids earlier, which tend to cause baby to weigh more, and then that percentage of the baby's weight loss after they are born can actually be higher than 7%, which is the normal percentage due to the IV fluids given to mom during labor and the whole birthing process. However, the IV fluids can also cause swelling of the breast and increase likelihood of breast pain. So again, there's really no indication that those IV fluids are necessarily needed during birth. It's actually, important for mom definitely to stay hydrated. However, mamas are pretty good at listening to our bodies and knowing what they need. And so just keeping hydrated with whatever, water or whatever we feel like we need is actually, just as beneficial, if not more, because those IV fluids definitely can impact your breastfeeding journey after baby is born because of the swelling. But then also if baby loses more than that 7%, then usually the pediatricians automatically jump to, well, then you have a supply issue and you need to supplement with formula. And again, Some mamas definitely have to supplement with formula. Some mamas choose formula. So I'm not knocking that, but for a mama that exclusively wants to breastfeed and she wants to breastfeed, you know, again, that is not empowering that mother and looking at what are some of the underlying issues that could be causing this weight loss or causing the breast swelling. It's not always a supply issue. It could definitely be the IV fluids. Now let's talk about the narcotic pain meds. These do actually cross the placenta and go into the baby's bloodstream, which causes them to definitely be more tired, more sluggish, drowsy after birth, which, you know, again, it's going to cause them not to want to latch onto the breast and be as alert as a baby who is not necessarily receiving those narcotics during birth. So narcotic meds are still used as, you know, some pain management techniques during birth. I forgot to mention, you know, oxytocin, when our bodies are able to produce an oxytocin on our own, that is actually a way for our bodies to deal and cope with the pain of birth. So again, when that is blocked, you know, our labors can definitely be longer and they can be harder on us, even with the Pitocin. My births were definitely completely different with Pitocin and without. So, you know, one major epidural is definitely discussed, and you're going to find research on both ends of an epidural as far as how it affects breastfeeding. But I'm just going to focus on how we know the epidural, how we do know that it definitely negatively affects, you know, the mama in labor, or it can, and the baby, which in turn affects the breastfeeding journey from the beginning. So we know that the epidural, it definitely decreases those oxytocin levels, which we've already talked about. Medication crosses the placenta. It also increases the fever, the risk of fever during labor for mama. And it definitely increases the use of forceps and vacuum, which have been known to cause breastfeeding issues as well. So again, though, the epidural, it definitely can cause, you know, a ripple effect again with those medical interventions that really just aren't needed necessarily for birth. Again, though, that has to be a mama's choice choosing an epidural. And if that is what you choose and you've been informed of the risk, and you are making an informed choice, that is all I care about. You know, again, none of this is necessarily talked about in our hospital breastfeeding classes or in our birth classes. None of these risks are talked about, or none of, you know, we're only told what is going to happen during our labor and birth and what are some of the pros. And so moms are not given this information. They're just not. A cesarean birth, recovery, you know, period is a lot longer. You're going to experience a lot more pain because that's surgery. You have an incision, and you're more than likely not going to have that magic hour with baby after birth. So that magic hour, again, is that skin to skin. It's that baby's first latch, and that is so, 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 so important within that first hour of baby being born, because that's that natural, intuitive, you know, just that experience that by nature that we're supposed to have with our babies. And so a lot of times with those medical interventions, it's a ripple effect that often lead to that cesarean, and mama is not able to have that time with her baby. Now, are cesareans absolutely needed sometimes? Yes. When there is a true medical emergency, absolutely. That is not what I'm talking about. But when we have like a 33% cesarean rate in a hospital setting versus I think the number is 7% for birth centers and home birth settings, that is an alarming number to me. And so just, you know, mamas, again, just being informed, you know, how their birthing experience can really affect breastfeeding later on, I think is super important for us to talk about. Traumatic birth. So I would say that my first birth was definitely traumatic, but traumatic birth can definitely lead again to postpartum depression, postpartum anxiety. Those medical interventions that just weren't necessarily needed, which again lead again to breastfeeding issues. I'm talking, more to those mamas who are definitely having traumatic births because their providers are not listening to them. They're in a hospital setting with all these medical policies that are not allowing them to do certain things. If you're in my Mama's Blooming group on Facebook, I just posted this week, a doula contacted me. This mama had been induced with Pitocin. She was in labor. Medical hospital policy said there could be no more than 2 people in the room with mama while she's giving birth. They told the doula she was not allowed to go in with mom as her support person during birth, and she was made to stand outside of the door. Mom had been pushing for an hour. Dad and mom were begging the hospital staff to let this doula in, who this mom had hired for her birth. And the doula could hear the nurses talking and told the mom that even though she was pushing, I believe it was on her hands and knees, that she would have to turn over on her back when baby crowned. And the mom said, I don't want to, in other words, I want to birth my baby in this position. This is the position that my body is telling me that I need to be in. And the nurse said, it doesn't matter. You're going to turn over. So I'm saying this again because I think it's an important conversation, because I do believe that our experience during pregnancy, our birth, so factors into that postpartum period of just being able to successfully breastfeed. So that's why I really wanted to touch on those today in the workshop, definitely. So I was going back. I actually did forget to talk about the hunger cues of your baby. So, a lot of those hunger cues we need to be aware about, the using the fist, the turning the head, opening the mouth, getting a little bit fussy and restless in the sleep. Those are the first, warning signs, or kind of the first level of those hunger cues. We don't necessarily want baby to be full on screaming. And we miss those first hunger cues because, again, especially in those first couple of weeks of life, if we're having latch issues, it's going to be harder to latch that baby if they are already upset and screaming. Now, this is completely different. I tell mamas, absolutely go take a shower when you need to. Have dad or whoever your support person is, postpartum, hold baby. Or if you have to go to the bathroom, you see babies over there rooting and you think to yourself, oh, if baby's hungry, I see the hunger cues and I need to go run to the bathroom and use it before, I feed baby. Absolutely. I'm not saying that you are neglecting your baby by any means if they do end up screaming. That's not what I mean. But it is important to be aware of those early hunger cue signs that you're going to notice with baby. So that ends the workshop, what I wanted to discuss with all of you all. I know there's a couple of you all on. You all can definitely use the chat option. I want to hear from you all. Any feedback that you have for me is definitely appreciated. This is your time to ask those questions in the chat, make comments, anything that you find that would be helpful for me to know. I am open ears, so this is your chance to ask those questions. If you are watching this on replay, with the link that I'm going to send you, shoot me a email or, message me in the Facebook group or post in the Facebook group, definitely, and I will be more than happy to answer those questions for you. I do want you all to know that today was just the free training, and I was really talking about those common issues and the myths and truths behind those breastfeeding issues. I will be hosting a Bring Your Baby to Class breastfeeding workshop on June 30th, and this is going to be about a 90-minute workshop, which is really going to give you all a lot more details and a lot more solutions for all of these many issues that we talked about. So now you know how to, really pinpoint those issues, that now you really need to know the solutions. So, I know myself, I went to the hospital breastfeeding class and I read one of the #1 breastfeeding books with my first, and it definitely did not prepare me for, you know, really recognizing all of these warning issues and signs for breastfeeding difficulties, and it definitely did not give me the solutions. You know, we're going to be talking about, you know, solutions to these latch issues, so different positions. We're going to be talking about how to get those babies' lips out and phalanged perfectly. We're going to be talking about postpartum issues. We're going to be talking about the nutritional value and how to get that nutrition into your diet to keep your supply up. And we're going to be talking about those clogged ducts and mastitis and how to deal with those. So we're going to be talking about a lot of things that hospital breastfeeding class definitely does not touch on. And, you know, I don't want you all spending a lot of time using Google and trying to find a support person for you. So this is your chance to attend this workshop, and you're going to have a chance to bring baby, because this is going to be all hands-on. If you are pregnant and you don't have your baby yet, that is okay, because you're going to have lifetime access to this workshop. I'm going to have worksheets available, a workbook for you all to keep on hand. So you're going to have all of this information right at your fingertips. And if you sign up early, I also have a sign-on bonus where you actually get a one-on-one session with me as your holistic mama coach. So keep that in mind. I'm going to post the link actually in the group chat. If you are watching this later on and you have the replay, I will also attach the link to your replay email as well. So thank you all for joining in. Like I said, I totally wish I had this information with my first, especially with my first, but also with my second, because it is so hard trying to find the evidence-based, you know, research and advice, and finding that support person that really can help you with your breastfeeding issues, and then finding a solution. You know, for a mom that's really wanting to exclusively breastfeed, telling her to just supplement is not necessarily a solution for that mama. And I know myself, just getting that feedback alone, I felt so overwhelmed and so frustrated, because all I wanted to do was successfully breastfeed. And even though I went to my lactation course and I read the book and I went to my pediatrician and all of that, it was super hard. They definitely did not give me the solutions that I needed. One question, as a doula, I have a hard time with mamas who think their supply is low, baby nursing all the time for a long time, as you described, maybe dream feeding. I feel like I have to convince them there is no problem when output good, latch, et cetera, tips. You know, Tanya, that is a great question. I think, and I said it in, you know, in this training in the workshop, because we see things on TV, we hear things from our friends, from our family, again, the pediatrician, you know, we hear a lot of the feedback that we get is, why haven't you given up already? Don't you know that if you would just give your baby formula, you wouldn't have to deal with all of this? I mean, I just don't understand why you want to go through the trouble of breastfeeding. And so, you know, I think validating their concerns, and so letting them know that, you know, some of what your head is telling you, and, you know, and some of what you are feeling is completely normal, because this is all new to you. And I know sometimes that the feedback that you're hearing and the so-called support that you're getting is not always supportive of you, mama, wanting to exclusively breastfeeding. But I'm here to tell you that from just what you've told me, from what I have seen with you and your baby, the baby latching, babies gaining weight, they're having, you know, plenty of diapers that are wet, and, you know, they are pooping the amount that they need, that you are doing an amazing job. And so I hope that helps, and not that you're not already doing that. But I think just the more that we validate and we normalize the struggles of that mama, that the more that we do that, and just letting her know, you know, if you have a question or a concern, reach out. But if, you know, I think, again, just normalizing that and letting her know, you know, you're not alone with these concerns. And often, you know, mamas feel this way all the time. But I think just giving them that evidence-based support and advice is really super important, because I'm here to tell you, they are not getting that advice all the time from lactation consultants. They are not getting that advice from pediatricians. And a lot of times they're not getting that support from sometimes even their significant others and their family and friends. So you being that support that they need and that one person that they can go to validate them, I think is super important. So I hope that answers your question. You know, but deep down, sometimes the mamas that have a lot of anxiety around breastfeeding, sometimes no matter what you say, that feeling of frustration and feeling overwhelmed and questioning is always going to be there. I would also say, though, it just came to my mind, giving them short-term goals. So, you know, a lot of moms that I talk to, sometimes they think, oh, well, my goal has to be that I breastfeed for an entire year. And so then what happens is they start feeling super overwhelmed because baby is 2 weeks old and they're experiencing cracked and bleeding nipples, or baby is, oh my gosh, baby is eating every hour and a half at night and I don't know if I can do this. Is this normal? So I think letting them know, you know what, you have been breastfeeding for an entire week. Do you know how amazing that is, mama? You are doing an absolutely fantastic job. Now, what are some ways that maybe I can help you to overcome some of those questions and feeling overwhelmed? You know, one way that we can do this is let's just make short-term goals. So, you know, contact me next Friday and I want to know, like, are you still breastfeeding? Also, I think normalizing them that breastfeeding definitely gets easier. You know, I'm not going to lie. Like, I don't care if you have all the support in the world and baby is latching perfectly. And I am not going to lie and sit here and say that breastfeeding is just rainbows and butterflies and you're not going to be sleep deprived and baby's not going to wake up to nurse and, you know, whatever, that I would be lying if I said that. However, I will say, you know, that we talked about that you will get on, that baby will get on a schedule. Baby will, you know, instead of wanting to nurse every hour and a half, probably want to nurse every 2 to 3 hours or so, or whatever it is. And they will eventually sleep a little bit longer at night. But again, telling that mama that, you know, you're meeting baby's biological needs. And waking up to nurse, you are providing that baby with what he or she needs is so important. Also, just letting them know, I know that I made a post the other day on my Facebook group, but also on Instagram, that breastfeeding mamas do actually get more sleep than formula fed babies, that their mamas. So, you know, letting them know that dream feeding, you know, that is your way of giving baby what he or she needs and getting the sleep that you need as well. And there's different ways, you know, the workshop that I'll be doing, we will be going over the importance of attachment and regulating your milk and letting your body know that what baby needs. But also safely, you know, co-sleeping. I know that's a big concern of a lot of moms because we hear it all the time. You are not allowed to sleep with baby. However, when done safely, there are definitely a lot of pros to that. So, you know, again, though, telling that mama, you know, that you are getting more sleep sometimes can be helpful. I know that some mamas on my Instagram were like, there is no way. It is, because again, if we're co-sleeping, if we're not getting up out of the bed to fix bottles, if we're dream feeding, those type of things, breastfed mamas are definitely getting more sleep. Tanya, do you have any more questions? Do you need any more support about anything? So let me see here. Thanks, that's great. Love the short-term goals. So how would you distinguish to a mama between baby working too hard at the breast because of latch issues and cluster feeding and dream feeding? Makes sense. Definitely makes sense. So with mine, I think you just have to look at, are there any other like warning signs? So like, even though my babies, they were nursing quite often, I had the bleeding and cracked nipples. There were weight gain issues. There was clicking at the breast. They had the milk blisters, the nursing blisters all around their lips. So I think distinguishing that, but also the dream feeding, which YouTube probably has videos that you could probably show mamas. So dream feeding, of course, they're not truly sucking at the breast. They're just kind of suckling. So there's a definite difference between dream feeding and a full-on latch where they're feeding. You know, the dream feeding, they are definitely in a dream sleep state. They are not nursing to necessarily get their nutritional needs met because they're hungry. They're getting that suckling instinct need within the baby to nurse. And again, that really does help with regulating our milk and production. I know I hear mamas all the time, well, I spoil my baby, or they're never going to learn how to sleep on their own if I don't lay them down, if they're dream feeding at the breast. It's okay, mama. I can promise you that one of these days they are not going to be sleeping in their bed and they are not going to be nursing. But for right now, you can't spoil a baby. You are providing that baby with what he or she needs. So I think, you know, the question is, cluster feeding is normal, but let's look at, are there any other possible signs or issues surrounding that cluster feeding or long feeding times? Are you seeing, you know, is baby nursing 20 minutes and then having a 45-minute suckling dream feed session versus a full-on, like, I'm going to nurse for an hour, which is what my kids were doing. So I hope that helps. Like, that is a great question, is definitely trying to distinguish what's a normal dream feed, a normal nursing session versus, okay, they're feeding an awful lot. What's the difference? So I definitely think looking outside of just the dream feeding or latching and nursing with all of the other possible issues that we talked about would be super helpful. So let me know if there's any other questions. Tanya, you're asking great questions that I know that when other mamas or doulas or birth professionals watch this, that they're going to have a lot of the same questions and the same need for information. So I am going to go ahead and post. Tanya, I'm going to post the workshop link in case you are interested. This workshop, again, it's an hour and a half. You're going to have lifetime access. You're going to have, if you do that sign-up bonus, you're going to get the sign-up bonus. If you do the early access between June 21st, you're going to have that session with me and just a lot of hands-on support. So you're going to have, again, you know, this is a good way, Tanya, for you to share this information with your mamas, because I'm a great resource for them as well. You know, even myself, I can't give, you know, every topic of support. So I think it's a good, you know, tool to have, is to have other support people and resources that your mamas definitely can touch base with. So here is the link for anyone who is on here that wants the link. And I'm not, oh, here we go. Oh, let's see here. I don't know, for some reason I can't get this on here, Tanya. I may just have to send it. Oh, here we go. Here it is. And like I said, if you signed up for the workshop, you're going to get this link as well. And this is a great series that I'm starting. And the first one is definitely, I'm going to give you all of those solutions that you didn't have before to take care of these breastfeeding issues. Because you do not want to wait when you're in the middle of the night and your baby is screaming his or her head off and you can't get them to latch and you're frustrated, the baby is frustrated, and you don't know what to do. I have been there, and that is not a good place to be. But with this help and these solutions, it's definitely going to help, you know, you mamas who are pregnant or the ones who are currently struggling. That's what I want to help you with. I want to make breastfeeding easier for you so that you can succeed on your breastfeeding journey. And that's what I'm here for. Tanya, do you have any other questions? If you do, you can comment below. If not, I'm going to hop off of here. Thank you all for joining in. I hope this was super informative. I will post the replay link. I will send it to you if you signed up, as well as the upcoming workshop. Thanks so much again, and you all enjoy your weekend. You're welcome, Tanya. Thanks so much. Bye.